Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today, and I see that people are continuing to join our webcast, so let's give them just another few seconds, and then we'll get started. Thank you to all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact families affected by MS every day. So as I chat with our expert today, please feel free to post your questions on Facebook and YouTube, or type them into the questions box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. People with MS may find that bladder and bowel symptoms interfere with their full participation in daily activities like work and recreation, but it doesn't have to be that way. Once diagnosed, these common MS symptoms are manageable, and most people find they can return to those activities that they enjoy most. Today, we're talking with Marie Namey, who up until last week was an advanced practice nurse at the Cleveland Clinic Mellen Center for Multiple Sclerosis. After practicing for 35 years, specializing in MS and in bowel and bladder dysfunction, Marie announced her retirement just last week, and I'm delighted to have her with us today. So congratulations on your retirement and welcome, Marie. Bladder and bowel function is probably not a favorite topic of discussion for most people. So can you get us started by sharing why this discussion is so important?
Well, I'm really delighted to be asked to talk about these subjects today because, as you just mentioned, these topics sometimes are not mentioned. They're not brought up when a patient talks with their healthcare provider, but they're certainly very important because they seriously and negatively impact quality of life for many people. People stay at home, they postpone different activities, they have that sense of anxiety and worry about their bladder or bowel not behaving at particular times. Or it can just be an annoying event that they have figured out that they just need to put up with. And that's not necessarily true. Talking with your healthcare provider about concerns, symptoms of bowel and bladder dysfunction can lead to a good assessment and then hopefully some remedies for people.
I'm curious, Marie, what percentage of people living with MS experience bladder and bowel issues?
So we don't have an exact number of people, but percentage-wise, depending on the literature that you read, 75 to 90% of people who have MS have experienced bladder disturbance at some time during their course of their MS. And it's a little less frequent with bowel dysfunction, but 35 to 68% of people have reported trouble with bowels over time with their MS. And it may not necessarily be later in the disease that people experience these symptoms. It might be early in the disease. So often as people have a bit more difficulty walking or getting around, perhaps the bowel and bladder issues become a little bit more evident because it just takes those extra steps, literally and figuratively, to get to the bathroom.
A moment ago, I heard you say that people with MS are sometimes hesitant to talk about these issues with their healthcare provider. What risks do people face if they don't address these issues?
Well, certainly there can be many complications that can occur if people don't have bowel and bladder issues addressed. People can develop bladder infections, and if they're not emptying their bladder completely, or if their bladder is not working correctly. And bladder infections, we have learned, can cause additional symptoms with MS. Typically, a person who has a bladder infection with MS may not necessarily have what we call textbook symptoms of burning or a dark urine or a smelly urine. What may happen is that their MS symptoms may get worse, particularly the stiffness that they have, fatigue, and maybe walking problems. We call this a pseudo exacerbation, meaning that it seems like an MS relapse, but in reality, it's something else that is causing their MS to seem to be a little bit more active. People are having bladder problems, they're leaking some urine. You know, urine is a waste product, and it can be an irritant to the skin. So people can develop problems with skin. Worst case scenario might be a decubitus ulcer, or a breakdown of the skin. Bowel problems can certainly, particularly the constipation, which is the most common event with MS, can possibly down the line lead to more problems like hemorrhoids and even cancer. I mean, if they don't empty their bowels, and again, this is a waste product and you want to get rid of it. And if it's sitting around too long, it may cause damage to those very sensitive tissues in our body.
You know, beyond just the physical implications that these issues may cause, how have you seen bowel and bladder problems impact an individual's self-esteem?
Well, sure. You know, most of us don't pay much attention to how our bowels and bladder are working until they don't work as well as we want. And then when there's surprises with leakage of either bladder or bowel, people can become very wary, and their life might be disturbed. They may not be as socially active because they're not sure about how their bladder bowel is going to behave, and they certainly don't want to have an accident. I mean, many people think of having a bladder or bowel accident is one of the most embarrassing things. Most people can tell me when their first bowel accident was. They completely remember that day. So it affects people very much. It can also be disruptive for sleep if there's particularly irritation to the bladder and people are waking up often. And then, if you don't get enough sleep, you're just not on your game. And so you're just not feeling as well. You may be more fatigued. It may impact mood negatively because, again, you're not able to do the things you like to do or plan ahead for some of the things because you're constantly worried about how your bowels and bladder are going to behave over time.
Let's drill down to some specifics, starting with bladder issues. What are the different types of bladder dysfunction that people with MS might experience?
So one of the fancy names of bladder dysfunction is neurogenic bladder. That neuro, of course, people should understand that, meaning, from the nerves. And so if the bladder is not working correctly, people can have basically three types of problem. One is inability to store urine, and that's that gotta go syndrome. There's that need to frequently and urgently get to the bathroom because the bladder in and of itself just is not able to store enough urine. And so I'm going to visualize with my fingers here a little bit, and I should have brought my balloons today. So if this is the bladder, as urine trickles in, this muscle gets a little overactive, and so it pushes out the urine very quickly. And that is inability to store. That detrusor muscle is overactive or spastic, as we say. Another problem would be inability to empty. And so that sphincter muscle, which is the gatekeeper, doesn't really relax as much. And so all of the urine can't come out, or doesn't seem to come out as it should completely. And so people hold on to urine throughout the day. They go to the bathroom, but they're not completely emptying. And that tendency of dysfunction causes people to have bladder infections. Again, urine's a waste product. If it sits in the bladder for any amount of time, more bacteria will grow and people will tend to have bladder infections. Also, if people are not emptying completely, it might be at nighttime then where their bladder decides to relax and they do empty more often. They go to the bathroom often, a term we call nocturia, waking up often to go to the bathroom. And that, again, that's disruptive for their sleep. And then there's the combination of both of those, combination of inability to store and inability to empty. Both that detrusor muscle and that sphincter are not working in coordination. And that has a fancy name called detrusor sphincter dyssynergia, meaning that there's not that coordination between the muscles in the bladder.
So sounds like someone can experience more than one of these issues simultaneously.
Correct. And so reporting symptoms alone is very, very important because that gives your healthcare provider a heads up as to start looking to see which type of bladder problem exists. And symptoms alone don't necessarily tell us if it's inability to store, inability to empty. The best way of assessing those symptoms is to do more of a formal bladder assessment. Some of those bladder assessments can be done right in the office of your particular MS group if there's somebody in that office who is dedicated to focus on bowel and bladder issues. I was sort of that person in our office. And it's a relatively simple evaluation. A lot of the evaluation includes what symptoms are bothering the patient most, to really drill down on those symptoms. Also to learn and talk about, well, what kinds of fluids are people putting into their body? Because certain fluids can activate that detrusor muscle. And then we have a patient go to the bathroom and we measure the amount of urine that they've been able to empty at that time. And then we use a simple machine, a bladder ultrasound, a bladder scanner, to see if there's any urine left over. These are non-invasive studies that can be done right in the office. It kind of gives us the first picture of how the bladder is functioning, so we can tell better if it's inability to store or inability to empty. In all honesty, that fancier detrusor sphincter dyssynergia syndrome can only be diagnosed if you see a urologist or a urogynecologist, and they do a special evaluation called urodynamic studies.
Do we know what causes MS bladder dysfunction?
So most people know that MS affects the brain and the spinal cord, and there's functions of the brain that help trigger our sensation to have to empty our bladder at different times. It's the part of the brain up here called the pontine Mellen Center, but really it's the spinal cord, the lesions or the footprints of MS in the spinal cord that deter those nerve impulses from getting down to that lower portion of the spinal cord, that lumbar and sacral area, where really those nerves there innervate for bowel and bladder. Now, MS doesn't tend to cause those lesions or footprints in the lumbar or sacral area. But if you think about it, as impulses are impeded or disrupted as they move down the spinal cord, that those areas just don't get the signal that a person needs to void when they should, or could wait if they don't need to empty their bladder, and also with their bowels.
Is there a correlation between overall disability level and bladder problems?
There could potentially be a correlation. I know some of the urologists would say, as the legs go, so does the bladder. And sometimes when we know that people are having difficulty walking, and walking is affected because people have irritation in their spinal cord, right? And so that impediment in ability to walk, we also can say affects those nerves in the lower portion of the spinal cord. So sometimes, yes, as a person does develop more disability, they can have more problems or be more aware, as I said earlier, of problems with bowel and bladder. If a person is more affected by MS and not moving around as well, it may take them longer to get to the bathroom. It may take them longer to undo their belt and their zipper and to move to the toilet and sit down comfortably. If people are not as active as they used to be, that can certainly affect the bowels, because we know that with bowels, people need to have some activity so that there's movement in the lower portion of the abdomen. So not necessarily, but certainly as people become more disabled with MS, these symptoms may be more apparent, but certainly bowel and bladder problems can occur early in the disease also.
What are some of the most common signs or symptoms of bladder dysfunction?
Yeah, so if there's a change in how a person has been functioning and going to the bathroom, that might be a signal, that might be an alert. So if a person could predict when they were able, when they needed to have when they needed to go to the bathroom to empty their bladder, if they got that signal and they were like, okay, I have a little time to get to the bathroom, but then suddenly the signal comes so fast, or maybe they don't even get the signal and they don't have time to get to the bathroom and urine leaks out, that's sort of an aha moment. Or if you notice that you used to sleep the night through and now you're waking up multiple times to go to the bathroom, that might be another signal that your bladder is not working as well. Or if you've not had bladder infections and suddenly you're developing bladder infections. Pretty typical for a woman to get one bladder infection a year, but more than one bladder infection a year is really a signal or a sign that something's not working right. For men rarely get bladder infections, so one bladder infection for a man would make me raise my eyebrows and think, what's going on that their bladder isn't working as well?
Karen tells us that when she gets the sensation to urinate, it's intense, like she may not make it to the bathroom. And the closer she gets to the bathroom, the more intense that sensation gets. Is this a common experience among people with MS?
Karen has really experienced kind of the textbook description of how people with MS feel when that urge comes. And that urge is immediate. And actually, for people who don't have MS, that movement and walking fast can actually irritate the bladder a little bit more. And so that urge becomes even more strong. And the closer you get to the bathroom, the less control there is over that sphincter, which holds the urine in, and leakage, or a little leakage, or even a complete loss of urine can occur. The best idea I suggest is that you have control over your bladder rather than wait for that extreme urge to come along. That people pay attention to when they drink and what they drink, and then time themselves to go to the bathroom so that they're more in charge of having time to empty their bladder. It's kind of like when you're raising your kids. You knew when they should be going to the bathroom and you would walk them in so that they would be able to relieve themselves of their urine. It takes about an hour and a half transit time from when we drink something to when it gets into our stomach, gets filtered through the kidneys, and sits in the bladder. So about an hour and a half after drinking something, and I'm talking more about drinking enough fluid, drinking 6 to 8 ounces of fluid at a time, and then letting that fluid get to the bladder at about the same time, walking into the bathroom, sitting down, letting all those muscles work in coordination and empty the bladder. I've said this many, many times, and I know that many people feel that they should be sipping fluid throughout the day. But as you sip in 5-minute or 10-minute increments, little amounts of urine trickle into the bladder. And if that detrusor muscle is a bit overactive, it'll cause that feeling of urgency and, oh my gosh, I better get to the bathroom. and perhaps it might cause some leakage. So if people are sipping through the day, I want them to kind of change their habit. And if they're going to drink their fluid pretty much within a 10-minute period of time, so that all that fluid can get into their bladder at about the same time, and they can empty and feel pretty comfortable and confident about that regimen.
A couple of minutes ago, I heard you mention infections, and we heard from Martha, who says she gets frequent urinary tract infections or UTIs, but sometimes Martha doesn't even know when she has one until she actually becomes very ill. Marie, what are the typical symptoms of a UTI, and might people living with MS experience different symptoms? And Martha also wants to know if getting frequent UTIs is related to having MS.
Yeah, bladder infections are common in MS, but they're common in the general population also. As I said earlier, women, one bladder infection a year in the general population is relatively acceptable or common. More than one, we kind of take pause and say, this really needs to be evaluated. My suspicion is that Martha is not emptying her bladder completely. And so that waste product is sitting in the bladder, growing more bacteria and causing the infection to occur. Typically, bladder infections would cause maybe pain and burning, maybe itching upon urination. Urine would be dark and smelly. And by the way, urine should pretty much be kind of straw colored. So if it's darker than that, my worry is that people aren't drinking enough fluid to really keep their urine lighter colored. So back to Martha, I think that maybe she's not drinking enough fluid, or she's not emptying her bladder completely, and that needs to be evaluated to find out. Typically with MS, people may not know that they have a bladder infection because those usual burning, itching, change in color or odor of urine don't occur. But MS symptoms might get worse. And it could be almost as subtle as fatigue getting worse, or it could be more like weakness, stiffness, people feeling like they've developed an MS exacerbation. One of the first things when patients call into the office and tell us that they think they're having a relapse of their MS or an exacerbation is we ask, have you had any change in your bladder function? And that could be a sign that we suspect that there's a bladder infection. And even if patients say, no, there's been no change, we pretty much ask them to go to their local laboratory and get both a urinalysis and a urine culture so we can rule out whether or not they have a bladder infection. If people are having a true MS relapse, we want to treat them typically with steroids. We don't want to give steroids right away if there's an underlying infection that's causing the problem. Even our secretaries at the Mellen Center would know to ask a patient about bladder because they knew from talking with me especially that bladder infections can cause people to have more MS symptoms and they think they're having a relapse. So Martha really needs to have her bladder evaluated. She can have a urinalysis and urine culture taken periodically. Her family doctor, her PCP may do this, or her MS specialist team, or her urologist may do this, and then talk with her about ways to help decrease her bladder infections.
So I think you just started to answer my very next question. Just to be clear, what type of healthcare professional should someone be talking to for their bladder issues?
So the first step, I think, is to talk with your MS provider team, and it could be anybody on the team. Typically your neurologist or your advanced practice provider could ask a few more questions about how your bladder is working, and then depending on what resources are in the office, either try to start managing those symptoms then or refer to a urologist or a woman, a urogynecologist, to do an evaluation of what is going on, because there could be other concerns that have come up other than MS that need to be evaluated. We talk a lot about different comorbidities people with MS have, and diabetes is one of those. And we know diabetes can affect bladder habits. And so that could be another concern people have. It's important to bring it up, as I said earlier, to any of your care team, because if you're seeing the physical therapist most and you're running to the bathroom often during therapy, that's disrupting that particular intervention. Your physical therapist can then help you discuss or communicate these concerns with other members of the healthcare team.
Can you tell us how bladder dysfunction is diagnosed? What types of tests are typically used to identify those bladder problems?
So it could be as simple as an evaluation right in the office, where we ask what the patient's habits are during the day, what their fluid intake is like, and do a simple post-void residual check with a bladder scanner. But if that's not available, if those resources aren't available in the office, certainly evaluation with a urologist. So that could be more involved, including a test called a cystoscopy, where they actually go into the bladder and look around to see what the bladder wall and the muscles of the bladder is doing. It could be an evaluation of the kidneys with different testing done for the kidneys, depending on the patient's particular history with other diseases or in mind. And it could be then as involved as this urodynamic study, which is what I talked about earlier, which is a little more involved and intimate of a study, where the muscles that help control movement of the urine through the system are evaluated. And again, that's done in a urologist or a urogynecologist office. If your neurologist or your neurology team it doesn't have a resource available, ask them for a referral to a urologist. Or maybe someone's primary care physician has a urologist that they have been working with that can help people who have MS.
What are some of the key treatments and management strategies that are used when it comes to bladder problems?
So it could be as simple as behavior modification. I mentioned one behavior modification earlier. Drink fluids within a 10-minute period of time. Drink your 6 to 8 ounces or even 10 ounces, and then about an hour and a half later, try to empty that urine from your bladder. It's also important to know that sometimes or oftentimes what we drink affects how our bladder works. So for anybody, not only those people who have MS, beverages that have caffeine, aspartame, and alcohol are irritants to the bladder, and they cause us to go more frequently and urgently. So I suggest that if you're drinking a lot of diet caffeine products, that you cut back, because that's aggravating your bladder. Coffee, which we all love. If somebody told me to stop drinking coffee in the morning, I don't know what I would do, but it's important that you know there are consequences to what we drink. So behavior modification like that can be very helpful. Stop drinking fluids 2 hours before you go to bed can help decrease the number of times a person might wake up during the night. Try to empty your bladder right before you go to bed may also be another strategy. There are multiple medications on the market that can help if people have that inability to store. They help allow that detrusor muscle to relax a bit. Now, with every medication, there's the good effects, and there's certainly some side effects. So you have to weigh the balance between that. But there are non-pharmacological approaches, like I talked about, behavior modification, and pharmacological approaches that can be very helpful with bladder. There's also some medications that can help if people are not emptying their bladder completely. They would allow that bladder muscle to relax a little bit and let that urine come out. Sometimes, if the bladder is not emptying completely and a person has developed bladder infections, a man or a woman can self-catheterize, use a tube to put into their bladder to allow urine to come out by gravity. A lot of people are very concerned when we first mention this, but it can actually be a very effective strategy that can help manage these symptoms very well. And again, allow a person to have control over their bladder rather than the bladder controlling their day-to-day activities.
Well, I'm so glad you mentioned self-catheterization, because we have a question from Jenny, who has been told by her MS specialist that she's not emptying her bladder completely and she may need to self-catheterize. Jenny isn't sure that she'll be able to do this. So I'm wondering what advice and tips you might have for Jenny and others who are either scared or reluctant to perform self-catheterization.
Yeah, I acknowledge the fact that this might be a very frightening and scary thing to do or to consider. But again, I suggest that it's a tool that people can utilize to help manage one of their MS symptoms. You know, many people wear glasses. Many people have hearing aids, and those are tools to help people continue to function in their day-to-day activities. And think of self-catheterization as another tool. A cane is another tool, a rollator, a wheelchair. These are all tools to help you. If Jenny has, and most women, to be honest with you, are pretty comfortable with their own anatomy, having given birth and understanding all of that. And if Jenny has used like a tampon in the past and is comfortable with that, she probably will find it easier to perform intermittent self-catheterization. And then for most people, it is an intermittent thing. She can look on YouTube. There's some nice simulations, if you will, of how catheterization can take place. And so she can become more familiar with that particular technique. But the best way to learn intermittent catheterization is to have a one-on-one training with someone who is comfortable with doing that education, somebody perhaps in the urology office or maybe in your MS office, to walk you through those particular steps of getting the procedure done.
Well, thank you, Marie, for sharing some very helpful insights into bladder dysfunction and helping us better understand the steps that people can take to address it. I want to take just a moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the question box if you've joined us on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. We're talking with Marie Namey, an advanced practice nurse at the Cleveland Clinic Mellen Center for Multiple Sclerosis, who's been helping us best understand how to address and manage bladder dysfunction in MS. We know bowel dysfunction can also occur in people with MS and sometimes can be difficult to manage. So let's focus on how to address and manage bowel dysfunction. Marie, what are the types of bowel problems people living with MS can experience, and what causes them?
So most often, the bowel dysfunction that patients report more is constipation. And constipation has a different meaning for individuals. But let me tell you, if people have been involuntary or incontinent of bowel, that certainly has been the most distressing symptom people have experienced. And it can be very embarrassing, and patients may be very reluctant to bring this up. But I applaud those people who do talk about it with their healthcare provider, because there are certainly many ways that we can help patients manage their bowels much better. Bowel dysfunction can occur with MS because those same nerve the interruption of the transmission of nerve impulses in the spinal cord can affect the bowel.
Well, what symptoms should people be aware of that indicate they may be having issues?
So again, a change in bowel habits for a person is pretty typical in alerting them that something is off. It's been recommended that people have a bowel movement every day or every other day. And actually, more recently, there's been talk about eliminating bowels perhaps twice a day. If you think about it again, bowel matter is a waste product, and it's harmful to hold waste or carry around waste for a long time. And so not having a bowel movement for 3 or 4 or 5 days or a week is really a long time to carry around waste. Now, granted, some people have had slow bowel for a good portion of their life, and then they get diagnosed with MS and there have been no changes. But still, I would caution people that they should try to help improve their bowel activity by keeping active, as that helps with that activity in the lower portion of the abdomen, by drinking enough fluids during the day to keep things moving along, and certainly having enough fiber in their body to hold on to that fluid and keep things moving along. Perhaps people have had slow bowel or infrequent bowel habits because they've really not paid attention to good nutrition or good hydration in other parts of their life.
Well, how do you sort out whether bowel problems are related to MS or something else? And what can that something else actually be?
So it's always challenging to try to determine what that something else could be. Since we know that up to 68% of people who have MS experience bowel dysfunction, we kind of make an assumption when people report to us that there's bowel dysfunction, that it is due to MS. But that doesn't necessarily leave off that there could be other underlying concerns. And so a thorough evaluation of the mechanism of how things are working may be necessary, like an upper gastrointestinal evaluation, a lower gastrointestinal evaluation, certainly a rectal exam, or if people are of age, a colonoscopy. But again, typically if people are reporting problems with bowels, it's important to get an assessment initially, talking with people about, so what are your daily habits? Are you moving around? Are you exercising? Are you drinking enough of the right fluids? And certainly, are you eating the right kinds of foods? Are you ingesting 20 to 30 grams of fiber a day? Which, let me tell you, is probably, the recommendation is probably a lot more than what people are actually eating. Because a lot of times people don't really know what foods really do have fiber. My goal is to get people to eat real foods. Certainly supplements can be helpful to get fiber into the body, but I think people need good nutrition to fuel their body. Fruits and vegetables and grains are really a good source of fiber. And many people don't get enough of these natural products in their body.
So if someone feels like this may be a problem that they need to have assessed, what type of healthcare professionals should they be talking about to?
So again, bring it up to your MS team. And if they have somebody in the team who can help you initially address these symptoms, you may feel most comfortable seeing someone in that team. If not, perhaps a gastroenterologist would be a helpful person for you to see, to do a more formal evaluation. I find, though, that often some simple behavior modification techniques can be very helpful for people with MS once they know what the steps are for having a regular bowel habit regimen.
So what are some of the key treatments and strategies that are used to treat bowel problems?
So basically, I have a meeting with the patient and I really drill down with them. What are you drinking? What are you putting in your mouth? What are you eating? And I know I can be annoying when I ask patients, when they say, oh, I have a sandwich for lunch. And I say, well, what's on that sandwich? What kind of bread do you have? What kind of meat? What are you putting any lettuce? So meat and fish really don't have any fiber. And so if people are eating a sandwich with white bread, any processed food, anything that looks white really doesn't contain much fiber. So people should be eating whole grain, darker bread, so wheat bread, a whole grain bread, a rye bread, which can add to their fiber. Cereal is a very easy choice for adding additional grains into your body. 1/3 of a cup of Fiber One, all bran or 100% bran, will give you up to 10 grams of fiber a day. And oh my gosh, that's almost half of what you need. And by the way, men tend to need a little more fiber than women. So I'd push them up more toward the 30 grams of fiber a day. You don't even necessarily need to have milk on your cereal, because I've heard from people, oh, I'm lactose intolerant. I can't take milk or milk products. And you don't have to. You can snack on cereal. 1/3 of a cup is not a lot of quantity, and it can be snacked on. But it's the fluid and the fiber working together that can keep things moving along. So 1.5 to 2 quarts of fluid a day, spaced out during the day, and then 20 to 30 grams of fiber during the day can help hopefully keep things moving along.
Aside from lifestyle modifications, behavioral changes, are there medical interventions that can be used here?
So if necessary, an evaluation of how the bowel tract is working needs to be undertaken to actually take a look and see how those particular muscles are working. There are certainly prescription medications that can be used to help people move their bowels along. There's certainly a lot of over-the-counter fiber that people can take, some of which are prescriptions, some of which are not, that can be helpful. But helping people get on a regimen for bowel habits, I think, is really one of the most successful interventions people can have.
Jeffrey reached out saying he struggles with having to go urgently at the most inconvenient times and wants to know if there's anything he could do to minimize this from happening. Marie, do you have any tips to help Jeffrey and others who are experiencing similar circumstances?
Well, I really empathize with Jeffrey, because this type of worry about when are my bowels going to move can be very limiting and add to some social isolation. And certainly if there is an accident, I'm sure Jeffrey would be very embarrassed about it. My suggestion is to try to plan for a bowel movement at the same time every day. It may take weeks, it may take a month to get back into a habit of a good regimen for someone. Most people, or a majority of people, seem to have that peristaltic activity, which is sort of a signal to have a bowel movement, after we eat or drink something warm and we're relaxed. So again, for people who drink coffee or have a hot cereal or a hot beverage in the morning, it may be about 20 minutes after eating or drinking something warm. Person should take time, go into the bathroom, and try to empty their bowels, and do this on a regular basis. I would suggest sitting in the bathroom maybe 10 or 15 minutes to try to have a bowel movement. If nothing comes out, get out, because you probably might have ring around the whatever, But haste does not make waste, I comment. You have to allow your bowels time to relax and let that stool move down and out. But if that isn't happening, you could maybe help try to encourage your bowels to move by learning how to use a suppository, a plain glycerin suppository, which can be purchased over the counter, can be inserted, and you're kind of like greasing the wheel. You're greasing that area of the bowel that's called the vault. The vault is the area where the stool sits. And if that suppository is inserted in the correct position, it can help allow that the bowel matter to move out. And usually once the vault is empty, it's pretty much emptied for a while. But again, I'd encourage Jeffrey to talk with his healthcare provider and work with them on a plan, learn how to use a suppository as needed, and begin to try to start a regimen of controlling bowel.
Well, Janice reached out and she's having quite the opposite experience that Jeffrey is. She told us that she only has a bowel movement once each week, and she feels very uncomfortable most of the week. Janice said she feels bloated, sometimes nauseated, and she experiences abdominal discomfort. What advice do you have for Janice and others who are experiencing constipation?
Yeah, I appreciate the discomfort that Janet is feeling, because not having a bowel movement for a week would certainly contribute to the bloating, the discomfort. Sometimes people have even reported headaches when they've not had a bowel movement over a period of time. And then there's always the worry, like, well, when am I going to have a bowel movement? When is this going to happen? Again, I recommend some behavior modification, that people get on a regimen to try to have a bowel movement within a day or two by eating regular fiber, adding enough fluid to their diet, and trying to have some activity to make sure that those bowel habits are occurring. But with a person who hasn't had a bowel movement in a week, I suggest that she try to get that stool out of her body. And sometimes a laxative like milk of magnesia or citrate of magnesia may be helpful. But let me tell you, then she's going to have to stay very close to a bathroom, because there's no prediction as to when those particular medications would be working for her. If this has been a pattern for Janice over time, she may need to be evaluated formally by a gastroenterologist, and perhaps she needs a colonoscopy or a sigmoidoscopy to see if there's any particular blockage that's going on.
Marie, as you mentioned earlier, talking with healthcare professionals about bladder and bowel symptoms can be difficult. We know it can also be hard to talk about these issues with your loved ones. Do you have any tips, first, that can help people feel more comfortable talking about these issues with their doctor and other healthcare professionals?
I think it's helpful if you know that your healthcare professional really wants to understand what symptoms are affecting your quality of life with MS. Oftentimes, your healthcare provider, your neurologist, your advanced practice provider may be very interested in your disease modifying therapy and your MRI. And I know that sometimes these other issues get overlooked, but it's up to you. Actually, it's up to your healthcare provider to ask about these things, but you really need to be your own advocate too, and bring up these concerns to your healthcare providers. And don't accept them as part of MS, that there's nothing that can be done about, because certainly there's a lot that can be done about bladder and bowel issues that can help. And it doesn't take a lot of time and effort to get that help. So I would encourage you to practice with a friend or someone else about how you're going to bring this up with your healthcare provider. Maybe you want to sit in front of a mirror and just bring it up and carefully say, I'm having these symptoms with my bladder. Is there something I can do about it? I'm having these symptoms with my bowel. Is there something I can do about it? and ask your healthcare provider if they are comfortable referring you to somebody who can help you with these concerns. Sometimes talking with a loved one is a little more sensitive, particularly if there's concerns about involuntary or incontinence of urine or even bowel. And I would encourage individuals to wrap it around the MS and say, you know, there's a variety of symptoms that I've experienced due to MS, and some of them are bladder and some of them are bowel, and I want to plan ahead. You know, I want to be proactive in how I manage some of these symptoms, because, I mean, in all honesty, bowel and bladder functions are just day-to-day activities that we all kind of take for granted until they don't work as well as we want.
Well, Marie, you've shared lots of helpful information today. What are the top 3 takeaways that you'd like our audience to keep in mind?
So I guess one is that certainly bladder and bowel concerns occur due to multiple sclerosis, and they need to be addressed. And it really is a combination of communication between the healthcare provider and the person with MS to bring up these concerns, because there are certainly many, many avenues of intervention that can be helpful for people to help manage their bladder and bowel concerns and relieve them of some of these worries that they have.
Well, thank you so much, Marie Namey, for joining us today, for helping us better understand how to best manage and especially be able to talk about bladder and bowel problems in MS. And I want to thank all of you who've submitted your questions to us. Thank you again, Marie.
You're very welcome. I'm hoping this was helpful.
I'm confident it was extremely helpful. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you. And these are resources that you can count on to be current, up to date, and of course, credible. I want to remind you that if we were unable to get to your questions today, the National MS Society's MS Navigator team is your best partner in answering your questions and connecting you to the very best information and resources. And it's worth mentioning that health insurance open enrollment season is right around the corner. MS Navigators want you to know that they have a lot of great resources and tools for anyone looking at their 2021 health insurance options. There's even a special team that's setting up appointments for Medicare beneficiaries during open enrollment to help ensure that your 2021 coverage is exactly what you need it to be. You can contact an MS Navigator by phone, email, or by live chat through the MS Society's website. And if you're looking for more information and resources on bladder and bowel issues, please go to the Society's website at nationalmssociety.org and search bladder and bowel. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I wanted to make sure that you're aware that the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. You can reach them by calling 1-800-273-TALK. That's 1-800-273-8255. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. With vital funding from supporters like you, the National MS Society will work to ensure that resources and programs like today's are available, and that the MS research community rebounds quickly from the COVID-19 pandemic so the progress and momentum toward finding a cure continues. As you're able, please make a donation to the Society's COVID-19 Response Fund by texting the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll consider contributing today. You can connect with the National MS Society on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And please make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. You can get on that mailing list by visiting the Society's website. I'd like to thank Marie Namey for joining us today, and I'd like to thank everyone who's joined us for the great questions that you've submitted. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmsSociety.org/MSExpert. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us to continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Marie Namey and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.